Welcome to The Explainer. Today, we are diving into a really fascinating and honestly pretty important international study. It uncovered a hidden risk for patients going into surgery, one that affects the brain in ways we're only just now starting to get our heads around.
All right, so let's start with something I think a lot of us can relate to. It's that fear many people have right before an operation, but maybe don't always say out loud.
You'd probably guess it's the pain, right? Or maybe a super long recovery, or even, the risk of not waking up. But what the research actually shows us is something totally different.
I mean, just let that sink in for a second. For a huge chunk of patients, the biggest fear isn't death. It's losing a part of themselves. The idea of waking up different, with brain damage or memory loss, that's a much scarier thought than not waking up at all. This isn't just some vague worry, it's their number one concern.
And you know what? It turns out that fear is grounded in a very real, but often totally invisible phenomenon. We all know what a major stroke looks like, with all the dramatic, obvious signs. But there's a much more common, hidden threat that researchers are finally bringing into the light.
So on one hand, you have the overt stroke. That's the one we're all familiar with. The kind you see in movies with sudden weakness, slurred speech. And while it's absolutely devastating, the good news is it's pretty rare after surgery. But the real story here, the thing we're focusing on, is the covert stroke. It has no obvious symptoms, but its impact is very, very real, and it happens way more often.
So, what exactly is a covert stroke? Well, think of it as a small area of brain damage. It's caused by a temporary lack of blood flow, and it happens right around the time of the surgery. But here's the catch. You would have no idea you'd had one unless a doctor did a brain scan, because those classic, dramatic stroke symptoms, they just aren't there.
Okay, so this brings up a massive question, right? If these strokes are silent, how big of a problem are we actually talking about? And do they really cause any long-term harm? To figure that out, an incredibly ambitious international study called NeuroVISION was launched.
And let me tell you, this was no small-scale project. NeuroVISION was the biggest, most detailed investigation ever done to hunt for these silent brain injuries in patients having all sorts of common, non-heart-related surgeries.
The way they designed this study was just brilliant. First, they enrolled patients age 65 and up and tested their cognitive function to get a starting point, a baseline. Then, and this is the crucial part, a few days after the surgery, they did a brain MRI specifically to look for any new silent damage. The final step was to bring those same patients back a full year later and test them again to see what, if any, the long-term impact was.
And all of that meticulous work? It led to a finding that was, and I'm not exaggerating, a huge wake-up call for the entire medical community.
7%. That was the number of patients who had a covert or silent stroke show up on their MRI after surgery.
Let that number sink in. 1 in every 14. This isn't some rare 1 in a million complication we're talking about. It's a common event, happening to thousands of patients every single day. And it goes completely unnoticed without this kind of specific brain scan. Okay, but here's the billion-dollar question. If you can't feel it, does it actually matter? Does this hidden damage really cause any measurable harm down the line? Well, the NeuroVISION data gives us a very clear answer.
Oh yeah, it absolutely does. The data showed that a whopping 42% of patients who had a covert stroke went on to have a significant cognitive decline 1 year later. That is a massive jump compared to the 29% who declined in the group without a covert stroke. So this silent injury is clearly directly linked to long-term harm.
And we are not talking about some tiny, trivial change here. The study's authors themselves point out that the level of cognitive decline they measured is roughly equivalent to 10 years of normal age-related brain aging. So, in effect, a covert stroke can prematurely age your brain by a full decade in just a matter of days.
And the impact doesn't even stop there. The study found that having a covert stroke more than doubled the risk of developing delirium, that state of confusion, right after surgery. And even more alarming, it quadrupled the risk of suffering a major overt stroke within the next year. It's almost like a warning shot from the brain that bigger trouble could be on the horizon.
So, this research is not just about scaring us, it's about finding a solution. The whole point is to figure out how we can protect the brain during this really vulnerable time. And the study points us toward a few key areas. So let's look at the clues here. The biggest risk factor, by a long shot, is having had a stroke before. But there are also things that happen during the surgical period that are critical.
things like a new irregular heartbeat, big drops in blood pressure, or a lot of bleeding. These are all huge stresses on the body that can mess with blood flow to the brain.
Knowing these risks gives us a clear playbook for how to prevent this. For a patient who's had a stroke before, it might mean it's smarter to wait a few months before an elective surgery. For everyone else, the focus is on what the medical team can control right there in the operating room. Actively managing blood pressure to avoid those dangerous dips, using techniques and medicines to reduce bleeding, and keeping a close eye on the heart for any rhythm problems.
So ultimately, this research is all about empowerment. It takes that vague fear of brain damage and turns it into a specific, preventable risk. It gives us, patients and families, the tools to have a real conversation with our doctors about keeping the brain safe during surgery. It's about asking not just, how will my heart do, but also, what's the plan to protect the most important organ I have?